Hello everyone, my name is Ali Shambiati, and this is my presentation on gonorrhea. Just a couple of heads up statements. I just got my wisdom teeth out, so if I talk a little funny, that's why. And also, there's a few graphic pictures in this presentation, but that's going to come a little bit later, and there's going to be a slide before giving you guys a heads up. All right, let's get into it. So we're going to start off with the history of it. The bacteria order was discovered in 1879 by Albert Nessier, hence the name Neisseria. I don't know why someone will name this type of disease after them, but he did. It is commonly thought that the term came from clap, which was a French term, clapier, which means brothel, where it may be widely and scandalously spread. This mainly happened through like ports to ports, from like sailor to sailor. During this time, the treatment was a mercury shot into the top of the penis, but shortly after penicillin was discovered, the treatment was eliminated around the 20th century. Okay, the bacteria were brought from the Americas to the European settlers and explorers, and it spread to the indigenous people. So the taxonomy of gonorrhea is the kingdom is bacteria, the phylum is Protobacteria, the class is Beta Protobacteria, the order is Neisseria. I hope I said that right, but I probably didn't. The genus is Neisseria, and the species is Neisseria gonorrhea. Okay, then we have, so this is, gonorrhea is a gram-negative bacteria, so we know gram-negative means there's a little thin layer of peptidoglycan, and is also non-motile, so like it can move when it's in a certain place, it'll stay there. It won't jump to a new environment for better like resources, nutrients, or anything like that. If the environment goes poor, then it will just go ahead and get eliminated. So the only reservoir is a human reservoir for this STD, and it can really be passed through any type of sexual like transition, like oral, vaginal, or just any like sexual contact. Next thing we have going on here is the morphology. It is Diplococcus, which means that there's two of them. They come in pairs of two, and they're round. Um, so for this bacteria is non-spore forming bacteria, therefore it does not lay dormant inside the body. So if you have gonorrhea, you will know immediately. It will never just be inside you, and you don't know. You always know if it's there. It also has membrae, which are attached pili used to attach to one another. And this is a bacteria STD, so it can be cured by antibiotics, but and it's not like a viral STD where you have to find other methods. So there's gonorrhea has symptoms in both women and men. They're a little different, but also they have a lot of similarities. The big one is they have a greenish or whitish discharge of the vagina in women and lower abdominal or pelvic pain. Burning while urinating is a very, very common one in both the female and the male. Also, you can get like red and itchy eyes, but that's not as common. Bleeding between periods is also possible, spotting after intercourse, swelling of the vulva, and burning in the throat, maybe like if there's like oral sex, swollen glands in the throat, also due to oral sex. And that also applies to men, I think, as well. So on the men's side, we had greenish yellow or whitish discharge in the penis, burning while urinating, same as in females, burning in the throat due to oral sex, painful or swollen testicles, and swollen glands in the throat also due to oral sex. So this is where I said that there is a little bit of a warning ahead. There's going to be a little bit of graphic pictures, but just bear with me. So right here, this is an example of what we just talked about previously in the previous slides. So in the right side, you see the male has a greenish, yellow, whitish like discharge coming out of the penis, and the same for the female. So in this slide right here, if gonorrhea is left untreated, in women, the infection can cause pelvic inflammatory disease, which may damage the fallopian tubes or even lead to infertility. Infection due to untreated gonorrhea could increase the risk of ectopic pregnancies, which this means that like the fetus does not the fetus is born outside and is mainly in the fallopian tube, and this is very dangerous for both the mother and the child itself. In men, the condition can this condition of the testicles can lead to infertility if left untreated. Without prompt treatment, it can also affect prostate and can lead to scoring of the urethra, making urination difficult and very, very painful. For both sexes, gonorrhea can spread through the blood and the joints, and if it is left untreated, and people with gonorrhea can also easily contract HIV more easily. Yeah, more easily. Um, Over here for the kids, because it can be passed on from mother to child. Gonorrhea is transmitted through through sexual contact with the penis, vagina, mouth, or anus of an infected partner. Ejaculation does not have to occur for gonorrhea to be transmitted or acquired. Gonorrhea can also be spread parentally from mother to baby, as I was saying earlier. So there are ways to treat it since this is a bacterial infection, not a viral one. So with bacterial infections, we know that they can be treated with like antibiotics, and a main one is penicillin, which we talked in the very first slide with the history, and Rocephin, Serprax, and Kypro. These are common ones, but there's also more that I have not mentioned here yet. Um, so clinical treatments, many people with gonorrhea also have chlamydia. So testing other STDs is important. So if you have one STD, it's also really important that you check for other ones because it's very possible. Patients are advised to have a second culture 1 to 2 weeks after the first, and additional cultures in about 6 months to make sure that they don't have gonorrhea anymore and that it is completely out of their system with taking these antibiotics, as we previously discussed. So another way to do it is by holistic therapies. So one way is by diet. We should cut out, if you do have, I'm not saying we, if you do have it, cut out fatty foods, sugars, white flour, salt, caffeine. This will help boost your immune system and flush out the bacteria. Vitamins and herbal supplements may be recommended, but are not, but do not replace antibiotic therapy. You can also use herbs as one of the natural home treatments for gonorrhea. If you are not taking antibiotics, maybe there's a certain herb that you could take. Um, so the tea tree oil is a treatment for gonorrhea. Aloe, aloe vera, sorry. Exception. So this is a very good method for fighting gonorrhea infections, and it really helps boost the immune system and kills the bacteria. Over here, we have some current statistics of gonorrhea. It is eliminated that around eight, sorry, it is estimated that around 800,000 new cases of gonorrhea occur in the U.S. each year. The cost of gonorrhea is, and its complications, is around $1 billion each year. So that kind of adds up there. Pelvic inflammatory disease, PID, caused by gonorrhea, affects 1 million women every year, which is also one of the previous symptoms we talked about in women. Cases of gonorrhea infection increased by 9% from 1997 to 1999 in the US. Gonorrhea cases peaked in the 1970s, then decreased, and now increasing again. Teenage girls account for the highest rate percentage of cases of gonorrhea. So in the next slide, we're going to talk about a little bit of this, we're going to show you a little bit of the statistics to wrap it up. Rates of incidence, so this is from the CDC itself, is showing from ages 10 through 14. This is you have 4.8 children in this case per 100,000 people. And we see that's not a lot, but we're just showing that it can be passed down from mother to child. And then around 15 through 19, whenever people are like growing up and they're experimenting, maybe they don't find the right partner and they are not using protection or anything like that, and they obtain gonorrhea. And we see that number spikes in both the women and the men. Then around ages 20, 24, it almost doubles because people become more sexually active. Around 25 through 29, it kind of lowers. I think people like understand. Also, that's when you take antibiotics and you try to get rid of it. And then we see as you get older, I don't know what happened around right here. I don't know why it just shifted. But as you get older, it gets less and less, but people are still sexually active, so it doesn't really go away. This is my disease report over gonorrhea. These are my resources. And yeah, I hope you guys have a great day and learn a little something. Can't wait for your questions on Wednesday. Take care.